Are you curious about the connection between gluten and celiac disease? If so, you've come to the right place. In this video, we will explore the myths and realities surrounding this often misunderstood topic. What is celiac disease? Celiac disease is an autoimmune disorder that affects millions of people worldwide. It is triggered by the ingestion of gluten, a protein found in wheat, barley, and rye. For those with celiac disease, consuming gluten can damage the lining of the small intestine and impede the absorption of nutrients. Celiac disease is not a food allergy, but rather an immune response to gluten. When people with celiac disease consume gluten, their immune system reacts by attacking the small intestine. Over time, this immune response can lead to long-term damage and a range of symptoms. Understanding gluten and its role in celiac disease. Gluten is a protein complex found in wheat, barley, and rye. It gives dough its elasticity and helps it rise. In individuals with celiac disease, the immune system mistakenly identifies gluten as a threat and launches an immune response. When gluten is ingested, it triggers the release of antibodies that attack the lining of the small intestine. This immune response causes inflammation and damage to the villi, which are small finger-like projections that line the small intestine. As a result, the absorption of essential nutrients such as vitamins, minerals, and carbohydrates is impaired, leading to various symptoms and complications. Common myths surrounding gluten and celiac disease. There are many misconceptions surrounding gluten and celiac disease. One common myth is that avoiding gluten is just a fad diet and not necessary for everyone. However, this is far from the truth. For individuals with celiac disease, following a strict gluten-free diet is crucial to managing their condition and preventing long-term complications. Another myth is that a gluten-free diet is a cure-all for various health issues, including weight loss, improved digestion, and increased energy levels. While some individuals may experience these benefits when eliminating gluten from their diet, it is important to note that they may not have celiac disease or a gluten sensitivity. The perceived benefits may be due to other factors, such as a healthier overall diet or the elimination of processed foods. Debunking the myth. Is a gluten-free diet necessary for everyone? The prevalence of celiac disease and gluten sensitivity varies among populations. It is estimated that approximately 1% of the global population has celiac disease, while a larger percentage may have non-celiac gluten sensitivity. However, it is important to note that the majority of people can tolerate gluten without any adverse effects. For individuals without celiac disease or gluten sensitivity, there is no need to follow a gluten-free diet. In fact, unnecessarily restricting gluten from the diet can lead to nutrient deficiencies, as many gluten-containing foods are fortified with essential vitamins and minerals. It is essential to differentiate between those who truly require a gluten-free diet and those who do not. If you suspect you may have celiac disease or gluten sensitivity, it is recommended to consult with a healthcare professional for proper diagnosis and guidance. The prevalence of celiac disease and gluten sensitivity. Celiac disease is more common than previously believed. While it was once thought to primarily affect children, it is now recognized that celiac disease can develop at any age. It is estimated that around 1 in 100 people worldwide have celiac disease, making it one of the most common autoimmune disorders. In addition to celiac disease, there is a condition known as non-celiac gluten sensitivity. Unlike celiac disease, non-celiac gluten sensitivity does not involve an autoimmune response or damage to the small intestine. However, individuals with gluten sensitivity experience similar symptoms, such as abdominal pain, bloating, and fatigue, when they consume gluten. The exact prevalence of non-celiac gluten sensitivity is not well understood, but it is believed to be less common than celiac disease. Symptoms and diagnosis of celiac disease. The symptoms of celiac disease can vary widely from person to person. Some individuals may experience digestive symptoms such as diarrhea, abdominal pain, and bloating, while others may have non-digestive symptoms like fatigue, joint pain, or skin rashes. In some cases, individuals may have no noticeable symptoms at all, making diagnosis challenging. To diagnose celiac disease, healthcare professionals typically start with a blood test to detect the presence of certain antibodies. If the blood test indicates the possibility of celiac disease, a biopsy of the small intestine may be performed to confirm the diagnosis. The biopsy involves taking small samples of tissue from the lining of the small intestine and examining them for signs of damage. The importance of a gluten-free diet for individuals with celiac disease. For individuals with celiac disease, following a strict gluten-free diet is the only known treatment. The complete elimination of gluten from the diet is necessary to allow the small intestine to heal and prevent further damage. A gluten-free diet involves avoiding all foods and products that contain wheat, barley, and rye. This includes obvious sources of gluten such as bread, pasta, and cereals, as well as hidden sources such as sauces, dressings, and processed foods. It is important for individuals with celiac disease to carefully read ingredient labels and be aware of cross-contamination risks. Gluten-free alternatives and tips for living with celiac disease. Living with celiac disease can initially be challenging, but with time and education, it becomes easier to navigate a gluten-free lifestyle. There are now many gluten-free alternatives available, including gluten-free flours, bread, pasta, and even beer. However, it is important to note that not all gluten-free products are created equal. Some may lack the taste and texture of their gluten-containing counterparts, so it may take some experimentation to find the best options. It is also crucial for individuals with celiac disease to be proactive in managing their condition. This includes educating themselves about hidden sources of gluten, dining out safely, and advocating for their dietary needs. Joining support groups or online communities can provide valuable resources and a sense of community for individuals with celiac disease. Research and ongoing studies on gluten and celiac disease. The understanding of celiac disease and gluten sensitivity continues to evolve, and ongoing research is being conducted to further explore this complex relationship. Researchers are investigating potential treatments, such as enzyme therapy, that could allow individuals with celiac disease to tolerate gluten to some extent. Other studies are examining the long-term effects of a gluten-free diet and the potential benefits or risks associated with its adoption. It is important to stay informed about the latest research findings and consult with healthcare professionals for the most up-to-date information and guidance. As our understanding of celiac disease and gluten sensitivity advances, new treatments and management strategies may become available. Conclusion: the importance of accurate information and support for individuals with celiac disease. In conclusion, the link between gluten and celiac disease is not a myth but a well-established medical reality. Celiac disease is an autoimmune disorder triggered by the ingestion of gluten, leading to damage to the small intestine and nutrient malabsorption. While there are many misconceptions surrounding gluten and celiac disease, it is essential to separate fact from fiction. For individuals with celiac disease, following a strict gluten-free diet is crucial to managing their condition and preventing long-term complications. However, it is important to note that not everyone needs to avoid gluten, and unnecessarily restricting gluten from the diet can lead to nutrient deficiencies. Accurate information and support are vital for individuals with celiac disease to navigate their dietary needs and live a healthy, fulfilling life. By debunking myths and promoting understanding, we can foster a more inclusive and knowledgeable society. Thanks for watching.